I'm Dr. Doug Xray from the Center for Manual Medicine and Regenerative Orthopedics, and today we're going to talk about musculoskeletal ultrasound and its benefits and how it can be used in evaluation and treatment of musculoskeletal problems, so all kinds of bone and joint type of problems. Musculoskeletal ultrasound has been around for a long time in Europe, but only in the last 10 to 15 years in the United States, and it's only been certified in the last 10 years. So it's relatively new in the United States. There's all kinds of expensive, fancy things like MRI scans and PET scans and things like that that are used for diagnosis. But this is a fantastic tool to be used, and one of the most important things about it is it can be used right now when you're having a problem. You're probably used to it from the standpoint of hearing about fetal monitoring or finding out the sex of your baby or something like that. It's used a lot intra-abdominal for gallbladders and things like that, but it's used now because high-frequency ultrasound has allowed the visualization of tendons and joints and structures that previously were not visible. So we're just going to take a look, and as we're going along, we're going to compare this to other imaging. So an X-ray is a shadow. You put X-ray against a plate and you make it go through the body, and what hits the plate is just the shadow. And so it's going to primarily show very large differences in structure such as bone and air, those two things in particular as compared to soft tissue. So you can see the edges of things, but you can't see in and out. It's a shadow. Okay, so in ultrasound, you're now going to take and bounce beams off the surface, and as you can see, a lot of detail. That bright white there is my radius bone, and you can see it turn here. So you get what's called real time. You can actually watch the structure move and do things that otherwise you would not be able to see in terms of a study that's called static. CT scan, MRI scan are both static studies. And so once you're there, you're in the machine, they tell you not to move. We tell you move or change, or let's look and see if stretching that will tear it. Not tear it open, but see if it'll open a tear. So it's a different type of study. Now, one thing you can see there is that that bright white bone has a dark shadow beneath it that goes all the way down to the end of the screen, and that's because ultrasound does not go through bone. So that's the one negative that you have with ultrasound. And when you're looking at joints, such as the elbow joint, and we're changing the depth there a little bit, looking at the joint there, and we can see it moving. So there's an elbow joint, and you see all the dark here above the bone, that's cartilage, and you can see it here. So I can put that into view, most of it, but I can't put all of it into view. So there's a small amount of the joint surface that I can't see. But that's really one of the only negatives of ultrasound. Otherwise, I can see so much more fine structure. I can magnify this to the point where I'm looking at the fine fibers of a tendon here attaching to a bone. So things that can't be seen on MRI scan or on CT scan. CT scan is excellent for bone and fractures. MRI scan shows both bone and soft tissue, but we're going to be able to see everything except for that one small space beyond the bone in the joint. One of the other things that's very important is that you can see blood flow. So we can have a different type of ultrasound called a Doppler, and this is called powered Doppler, which reads very, very small amounts of blood flow. And I can follow that radial artery as it comes through. and watch it go down through into a joint there, and you see a drop, and it actually goes from there over to the other side, so that it's going from the front part of your hand and wrist to the back. So here it is on the front. It drops down, and then if we go back around to the back, there it is on the back. So you can follow blood flow. You can also see with this type of power Doppler, blood flow that's very, very small, that indicates inflammation and other types of problems. So this is a very powerful diagnostic tool. When you come into the Center for Manual Medicine, I'm usually using this tool with my evaluation. So you're here for one visit. You get an evaluation, history, and physical exam, and we do a wonderful physical exam, but that includes most of the time an ultrasound exam if the structure or problem indicates it. So if you're having a musculoskeletal problem, pain in the joints, give us a call for a consultation, and we will give you an exam that includes ultrasound if needed.